Hi everyone, welcome back to my channel. Today we're going to be working through scar tissue. So if you've had surgery, if you've been in an accident or have had to have stitches of any kind, maybe even problems with your earrings, you've had keloids form on there, you can use this method to help work out the scar tissue and smooth the underlying tissue. As always, I recommend that you see your dermatologist and just double check that this is the right kind of treatment for your scar, just so we're not causing more problems and we know that you've healed completely. I'm going to be working on the abdominal region today. So I have recovered from gallbladder surgery. I am about 2 months out, and I was using this method to help treat my scars to help them heal a little bit faster. I would encourage you to wait if you have had surgery and stitches to make sure you're cleared from your doctor. So make sure that you've had your post op appointment and be sure to ask them about doing this kind of work. And as always, when you're working through this, make sure that you feel comfortable, that nothing hurts, that you're able to trust your body enough and you're able to trust yourself enough to know what's good for your body. So, just a little review on what scars are. So, there are typically four different kinds of scars. You've got your hypertrophic scars. They tend to have excess collagen deposits that appear underneath it and kind of raise it up. And it's not always as present as like a keloid scar. A keloid scar is going to be where it kind of bumps up underneath it and it appears firm, usually type of rubbery, maybe even shiny, and it might have like these kind of fiber like nodules underneath it. We also have atrophic scars, which is where it leaves a concave appearance in the skin. So, especially if you've ever had tissue removed, you're going to have more of an atrophic scar. Those are a little harder to work with just because you're missing tissue. But definitely, if it is tight or uncomfortable, you'll find some relief with this. And then there's contracture scars where the skin gets pulled really, really tight. It can restrict your mobility quite a bit in your daily movement. You'll see this a lot with people who have burn scars. They'll typically have a contracture type scar. If you've had road rash or anything like that, that's usually a contracture scar as well. Today, we're just going to be going over a basic type of incision scar. I'm going to use myself as the model. So I'm going to pull my shirt up here, my little pandas doing yoga. And you can see I've got a couple of those incision marks on my stomach. And everyone's going to have a scar that they feel ready to work on. I have actually had this lower scar here. The tissue underneath it tore, and so I didn't actually get to massage it enough. I think before I kind of felt that underlying stitch rip. So I had to wait a couple of weeks before I could start doing this to that area again. So again, I want to caution wherever you're working, whether it's you have a full scar down the tummy and it's a big, hypertrophic raised keloid scar. I would encourage you to listen to your body. Your body usually knows best. If it doesn't feel right, it's probably not right. I'm going to use this top scar. I know it doesn't look bad, but there's a lot of tension that has developed underneath this spot. And what I'm going to do is just use a little bit of oil. Depending on the size of your scar, you may want to use a little less or a little more. So I'm not even pumping it out. I'm just rubbing what's on the tip on my finger. You can also use a lotion. I like oil because our skins naturally produce oil. And so I feel like I get a better glide. And I kind of like to just start with applying in an up and down or cross fiber motion. So if your scar is this direction, side to side, you're going to want to go slightly up and down to start. And I recommend just applying a little bit of pressure and trying to stay right on top of that spot. So we're not going big up and down motions. It's a really small motion up and down. And usually, especially if you've been doing this a while or you're just really in touch with your body, you can feel areas that feel bumpy, maybe they're catching. Um, and you just kind of want to work through that. So I'm going to get in here, I'm going to find that spot again. I've got a kind of a little bump here. I'm just going to get on top of it. I'm going to just really gently do that cross fibering work. just going the opposite direction up and down from the scar. And if you have a contracture scar, you may want to do broad strokes to start. So just big, like trying to get the skin to move. So we're not just rubbing on top of the skin, we're actually trying to shift the tissue underneath our body. So that one feels pretty good. I've just got one little space on here. You can do this for as long as you like. I usually recommend just a few minutes. If it's sore, you might back off of that, and again, talk to your doctor about it, because we want your stitches to stay intact. So if your stitches have not dissolved or been removed, then let's skip this. Okay, that one feels pretty good. I'm gonna just kind of move on to my other ones here. Again, I'm just using a little dab of oil, not much at all. This is the one that ripped on me, and it feels definitely like it ripped underneath the skin. On this one, even though it's a side to side, the tissue feels like it's actually going this direction underneath it. And so I'm actually going to continue to do a side to side motion, and I'm going to pull my skin a little taut. So if you have a little belly, you've got a little skin there, it's okay. You can pull your skin a little taut and then just kind of find where you feel that fiber going. So I feel it going kind of up and down this direction, like it ripped horizontally, and so, or ripped vertically. So I'm going to go horizontally on it, and I'm just doing a little cross fibering motion up and down on where those bumps are. And this will help reduce the appearance of your scars, especially depending on what type of lotion or oil you're using. You can get stuff with extra collagen, but really anything like vitamin E is really great for your skin. A, E, and D are great. I just use a blend of sunflower, avocado, and gosh, what else is in it? I don't know. Now I can't think. So you can work it for as long as you feel like you need to. I try and just do it for a minute or two, and I'll kind of go both directions again, and maybe I'll find a different spot. Like there's kind of a little bump right here at the bottom of it, and I'll just kind of go a little side to side, up and down, just working those little collagen fibers deep underneath the skin out so that they can repair the correct direction. Good. I'm going to do one more. We'll do this one over here. The one over my belly button gets pretty tender, so I have not worked this one as much, but I probably need to start getting in there and working that one as well. I'm being cautious with my own body, so I would encourage you to do the same thing. If something doesn't feel right, probably not right. So just a little application, pulling the skin taut if you need to. And then again, this one definitely felt like it ripped more vertically, so I'm doing a little more horizontal motion on it. And if the scar is really bad in the tissue, you might notice some numbness. As long as you're comfortable with the numbness or tingling, feel free to keep working. If it makes you uncomfortable, please stop. This is the only one of mine that has been like that. And it's pretty deep in there. I can feel like if you push in a little more, you can usually get a little deeper in that dermal layer. But those top two layers are the ones where that scar tissue will really form. And you can do this pretty much anywhere on your body. You can do it on your ear, you can do it on your neck, your leg. I've seen a lot of women who have had their uterus removed, and even people who've had to have their whole abdominal cavity opened, and they have contracture scars around where the skin is really tight, and then they have a keloid scar right in the middle. And so with that, you'll want to do kind of the same thing, really broad pressure, um, going back and forth, and then gently going up and down. Always using a little more pressure as you come towards your heart. So we want the blood flow to be good. Those all feel pretty good. Hopefully this video helps you guys, and you're able to get your scars to be reduced a little bit, maybe get a little bit more mobility in some areas where maybe you didn't have it before. Again, like I said, you can pretty much do this all over. I've got a nice little scar down here. This was my contracture scar. You can kind of see that some of my ink is missing. It was a much wider, larger bulge, And I've kind of just worked it over time. I've just gone in there and done a little bit of back and forth, just not even with lotion half the time, just kind of moving it around. And I wish I had a good before and after of this one, because this one was really more puffed up, and now it's flat and flush with my skin. And I just have a little white spot where I lost some melanin, and my ink is missing now. So that really expensive work I got done is um, a little less expensive. So anyway, I hope that helps. Again, good luck, guys.